welcome to the MAPS monthly webinar series, Healing Tomorrow's Future. We are thrilled to bring you this new series packed with valuable information and education for our community. My name is Honey Renisella, and I am the Executive Director of MAPS, the Medical Academy of Pediatrics and Special Needs. With these webinars, we're aiming to empower our clinicians with the knowledge and tools needed to support patients that find a variety of health challenges. For more information about MAPS or to register for our conference, please visit us at www.medmaps.org, medmaps.org. Thanks for joining us on this journey towards a brighter, healthier future.
Okay, welcome everybody to another edition of MAPS Healing Tomorrow's Future, our webinar series that we started not too long ago. I have a few on the books now, but I am super excited today to welcome one of our very own, an FMAPS fellow in our academy, Emily Gutierrez. So can you tell everybody about yourself?
Well, first, thank you for having me. It's an honor to be on your new podcast. So I hope your listeners are enjoying all the pearls I'm sure that they're getting. So I am a doctor of nursing practice, and I am a pediatric nurse practitioner. I'm not only certified in MAPS, I'm also certified in functional medicine from the Institute of Functional Medicine. And just because I like learning and I keep adding those letters behind my name, I'm a certified clinical nutritionist. I think probably what's most interesting to the listeners is I started Neuronutrition Associates about 12 years ago. And at that time, it was one of the first pediatric functional medicine clinics in the state of Texas. I think I was right next to Paula Krepestad in Houston. But we went through IFM training together. So yeah, I've been doing this functional medicine approach to chronic complex illness for a good bit of time now. And it's really been a fantastic journey. And I'm happy to be on the podcast and share some of the pearls.
We are very excited. It doesn't feel like you've been around that long, you know what I mean? Because of just, us meeting and you coming to MAPS, but you really have had quite a background and you have so much knowledge in the whole pediatric functional space that we felt like today's topic would be perfect for our listeners. We were talking about how you started up your functional practice, kind of moving from that mainstream model more into how you kind of see patients day to day. So we figured that would be a great topic if you'd like to kind of go into that with our listeners, just how you got started, things that gave you a challenge, because I know a lot of people we hear at our conference, they really would love to start a practice and they would love to kind of break free from that model that that mainstream world and insurance model that they kind of feel trapped in. So I know it's a daunting and scary kind of topic, but I know you do it so well. So maybe you can give our listeners a little insight to that.
And it really was daunting and scary when we first started. I was working in primary care with a vaccine-friendly clinic in Austin, Texas, meaning, they didn't make people vaccinate on the schedule and they would come alongside patients. And so, honestly, right out of the University of Texas at Austin, I'm a very allopathic trained provider. And then I had all these crunchy moms that, wanted their essential oils and their, vitamins. And here I am. And I think I'm the medical authority in the room. And they challenged me, man. They challenged me a lot. So when I went to Johns Hopkins to work on my doctorate, the question was, what's your problem in practice? And my problem was I didn't know how to deal with all these hippie, tree-hugging mamas that wanted this different style of healthcare that I had no training for. So through my doctoral work, I figured out, or I studied how to translate. And that's what a doctor of nursing practice is. It's translation. What's the evidence? How can we apply it in practice? And then how can we improve outcomes? So I studied the translation of integrative medicine into allopathic care. So naturally, when I got out, I was like, well, I can't go back into the allopathic model of, seeing patients every 10 minutes and feeling exhausted and quite frankly, a little bored at the end of the day. You're going through all these algorithms. While I always think that you should treat strep throat, always, 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 doing it 6 times a day and, well visits where it was the same questions and it was just rinse and repeat. I was a little disenchanted and I knew I had to take my newfound knowledge and apply it differently in practice. And that's where Neuronutrition Associates began. because I couldn't fit into anybody else's model. And so in the state of Texas, and I know every state's a little different, you can own a medical practice as a nurse practitioner, which, that was hard because, people are like, you're a doctor, nurse, what? And you started what kind of
They
medicine?
don't
What's
get it, right?
functional medicine?
There's a lot of questions, a lot of
A lot
questions.
of questions. And I recruited Jana Rosa, who's also an FMAPS. And I
She
said,
is, we love her.
you got to come along. I mean, like, I need a buddy. I need a buddy doing this. And at that time, she was working in a Medicaid clinic, really seeing like, I don't know, 45 patients a day. It was nuts. She was just like, she was strung out as far as like feeling super overworked and stressed. And she had started really changing her diet and her lifestyle based on her, gut and her gut symptoms. And she's like, I'm in, let's do it together. So we founded Neuronutrition Associates and we thought, oh my gosh, are we going to have one patient? Who's going to come to
Oh,
the,
silly you. Oh, silly you.
yeah. We're like, oh, I don't know. Will they come? And when we started, we decided, I got some really good advice from Alejandro Carrasco, who owns Nourish Medicine. She's a functional medicine physician. She was actually one of my physicians at the time and becoming a dear friend. And she said, Emily, do not start an insurance-based model. You will be chasing insurance the whole time. And it's just be very transparent. These are your fees. This is upfront, and your patients will come. People will come. They want this type of healthcare.
They absolutely do. I mean, we have so many parents that come to our website, aside from doctors, right? 4 out of 5 hits on our website are parents, and they're kind of used to that at this point because they know the 10-minute in and out isn't going to get their kid better, and it's such a struggle. And I feel so bad for those physicians and nurse practitioners and DOs that want to help, but just feel like, how do we do it? There's really not any time. You're kind of bound by those insurance kind of rules and regs. And I just have to feel that this is so much more rewarding for yourself and others that choose to do this. Nerve-wracking, I'm sure, and a little scary, but definitely rewarding.
Right. Well, it was, my husband thankfully came into the business with me, and he's a business guy. I've been in tech and did virtual officing, did a bunch of things. And, I'm like, I know couples shouldn't work together. However, what do you think about, helping with the business model of this? And it was really great. I learned about Excel and QuickBooks and all kinds of things he taught
All
me,
the
but
fun
really
stuff.
all the fun stuff. But it was like, how many patients do you need to see? And what's your cost? I mean, those are like the big things, like keep your cost as low as possible. And then, if you see X amount of patients, you're going to make X amount of revenue. And it's really you're trying to make more revenue than your expenses. And so we did that. We were like really trying to keep our expenses low with seeing enough patients to pay ourselves, to have a salary, and to feel like, we were making it. And you know what happened? We were profitable in the first month of business.
That's
I mean,
amazing. I mean,
the,
not surprising to be honest from this side of it, but I'm
oh,
sure, like I said, scary. The fact that that should give so many people hope that if you build it, they will come. It's really
yes, I
true.
know.
It's a real thing.
Oh my gosh. And it was scary too, because it was like, well, we're really good at, when we first started, we did a model of both. We did some primary care and we did some functional care, and we would just code our visits. Like if it was a sick visit, it was X amount of dollars. If it was a well visit, it was 30 minutes and it was X amount of dollars. And if it was a functional visit, it's going to be longer amount of time and more money. So, we parsed out our time like that, which was helpful because there was a lot of people that were being kicked out of other practices because they wanted to have a delay in the vaccine schedule, or because they were just having other providers just keep putting them on antibiotics over and over again. So they're like, oh yeah, you mean you can provide us some of the foundational integrative care? And so I think that helped really kickstart us, that we weren't all functional, that we were blended with integrative.
That's a good point. I was just thinking while you were talking, a lot of people might not realize, like a lot of our practitioners that come to MAPS, they might not realize that you can do that model. It's really kind of how you decide to design your practice. With
Right.
that well visits, like you can offer all that. You don't have to just be a functional, I treat autism, that's it. You can open that scope because things you learn throughout, school and your education and things you learn at MAPS, you can apply that, across the board, obviously. So it doesn't have to just be that one functional autistic practice.
That's right. And sometimes people don't understand the word functional, but they do understand the word integrative and holistic. So if they're like, oh, okay, integrative care, they're going to be more natural, they're going to be more holistic. There is a part of the population that just feels more at ease and safe, and there's a higher level of trust to when you are doing a sick visit and you're like, well, there's strep, we should treat with ceftonir or amoxicillin or whatever your choice is. They're more likely to say, okay, they understand the consequence to the microbiome of overprescribing antibiotics. And if they didn't think it was necessary, I know that they're more likely to say, hey, no, we can just do some biocide and throat spray, which I don't recommend. So, but, so
Love biocide, by the way, just sometimes you got to treat things a little harder. That's all.
yes, well, you don't want to end up with pandas, right? We don't want to end up with strep in the brain.
That's a whole other talk.
Yes.
Emily, we could go on a tangent with that one.
Yes. So it was good to build the practice by having both, and it just determined, we said, okay, an hour rate is this, and we are willing to parse it up like this. And this is how many consults we need to hit in a day to make our numbers so we can pay the rent, we can pay all of, the fees that it costs to be open in practice. So, yeah, it was.
Now, what do you think, since you parse it out, do you also tell everybody listening about kind of that telemedicine? Because that's been, since COVID, it blew up, but even before that, it makes you a lot more accessible, but I'm sure there are rules and regs to that as well.
Oh, I'm so glad you bring it up. Because I think during COVID, things kind of like the lines got really blurry because we were all most of us were giving care from home. And then the lines meaning state lines. So as a nurse practitioner and as a physician, I know that when you provide care outside of the state that you're licensed in, that's not typically a good idea. So telemedicine, 12 years ago when we were doing telemedicine was, maybe we're in Austin, Texas, and they were in Dallas and they didn't want to drive in. So we were incorporating some telemedicine from the very beginning. And it's tempting to say, oh, well, if I do telemedicine, I can just see anybody from anywhere. But you really got to dot your I's and you got to cross your T's and you got to be within the regulations of your licensure. So like, it's very specific to what profession you're in, a DO, an ND, a chiropractor, you name it. But as a nurse practitioner, I'm licensed in Texas, New Mexico, and Colorado. I will not see a patient outside of that. If they've lived in Texas and they've moved, I'm like, well, I need to call medicines in here and, I need to see you in person once a year. So there are you got to be careful based
Yeah,
on.
you just have to be very careful. Yeah. But you bring up a good point about calling in meds and scripts. So can you talk to us a little bit about that? Because again, I know you're in Texas and it differs from state to state and credential to credential. But give us a little oversight on that.
Yeah, so it depends on where you're licensed, right? So I could call, even though I'm in Austin, I could call in a medicine in Colorado or New Mexico, no problem. And then there's this gray area of compounding pharmacies that will ship anywhere. So, if they're like, well, I don't want the Walgreens down the street, but we're going to call it into, like I call a lot of medicine into Anju Usman's pharmacy. I love her B12 injections. I trust that she's compounding them very well, which
Very well.
got to be careful. There's not all good compounders out there. But they're licensed in all the states so they can ship and they would let me know, hey, Emily, I'm not licensed in Texas. I can't ship there. So compounding pharmacies are interesting. Some in your state will be licensed to ship within the state. We use Alive and Well here a lot, and they're licensed in Texas, but I don't think that they could ship any, to my Colorado or New Mexico patients. So you got to, especially with calling in prescriptions, you got to be really within the lines.
Now, when you were starting this amazing practice up, what were kind of some of the pitfalls, some of the, roadblocks that you feel like you may have hit, and that could help others maybe not hit those, avoid them, or just be ready?
Hmm. That's a great question. And while I love newborns, I mean, I love them. I love seeing them right when they come out. I love their, first visit from the hospital. I love that 2 week check. But Jana and I started, we were like, oh, we're open to anything. And mamas were like, yes, we want you to see our newborns. Newborns take a tremendous amount of time. And you need to be pretty much on call for them. So that's one of the first things that we stopped is we stopped seeing newborns and we started saying, 6 months and older, we'll start to see your kiddos. And then there was, just as we became more well known for our functional medicine approach and the visits got longer and longer, one of the pitfalls is a family came in and they're like, oh, we're coming in for a well check. And then they'd have, oh, I just was diagnosed with autism. Well, that's not really a well check. That's really a functional medicine check.
That's going to
So
take a little longer.
yeah, it's like, well, yeah, that's going to definitely take longer and more visits. So just defining those boundaries was so important right up front because, not maliciously, but people naturally kind of push the boundary. Oh, I'm coming in for a sick visit, but can we talk about the well visit, the functional visit we did and go over the plan? And it just becomes, it kind of sabotages your time. So, however you determine, I'll do 4 sick visits a day and 2 well visits, and the rest of them are going to be functional, which is a lot of work. Maybe not that many.
Not recommending that right from the start.
Yeah. And remember, boundaries are for you, boundaries are for us, boundaries are for me. And, setting healthy boundaries helps people to know how you like to be treated and vice versa. And it's, I'm a people pleaser. I'm please like me. And am I good enough? There's that like childhood thing that I work with. So I've learned over the years that it's okay to set boundaries. It's okay to set boundaries because it protects the relationship between you and the family. And that's
You
great.
guys want to help so much. Our community just wants to help. And I can imagine it's very easy to get burned out because not only are you looking at each patient professionally, right? You're invested. It's an
Yeah.
emotional thing, especially when you are seeing kids that have different diagnoses. And I'm sure it takes a toll on you and it's hard and you really want to put your all into it. You have to make sure that you're giving yourself some grace and some time, right?
Oh, yes, for sure. So there's a psychological disorder called adjustment disorder. Have you ever heard of that before?
No, but I'm sure you're gonna tell me, and then I'm gonna be like, oh, okay.
It's mainly healthcare providers that are in burnout, get it? And it means that you're not able to adapt to the stress that you're adding into your life. And what happens when people can't change it, they're more likely to have an episode of depression that's pretty severe. So like I feel that as a healthcare provider, like if you are in that place of like, I want to help, okay, I'll add one more. Okay, I'll get on, the EHR at 7 at night every night and I'm working on Sundays, you're just going to really, really burn out. And so when you're creating your practice, not only having those good boundaries, but, boundaries towards patients, but also yourself, you have to have your own boundaries because this work is really complex. There's many different pieces of it. And I think that we can go down that rabbit hole of like, oh, we can do this and this and this and this. And then it's just like, wait, for this visit, we're really going to focus, what are our goals for the
You don't
visit?
want to get ahead of yourself. And
Right.
like you said, root cause medicine, you could be chasing things and having different perspectives on how to treat and, what kind of intervention to use. You have to just breathe, I'm sure.
Yeah, and you can't fix everything at once. And if you're like, okay, we have 60 minutes for this visit and we have 8 goals, I mean, that's not realistic. 2 to 3 goals for the visit. That's realistic. And knowing, we're going to work on this, and this is the timeline that I want you to come back, and we're going to continue to layer in and work on other things. So the pitfalls are really boundaries, boundaries, and I think paperwork in the beginning of the relationship is really important, meaning your patient consents. So when are we open? Are we serving as your primary care, or are we not? When is it reasonable for us to get back with you within the portal? How many days do we reasonably have? How many portal messages can you send in a month? Is it unlimited, or is it 7 a day? There's all these opportunities for boundaries and expectations. So that is really what I would suggest for providers, curating and thinking about and creating their own practice in their minds, is get the consents right in the beginning and get real clear on what your boundaries are.
That is a great piece of advice. I'm sure everybody's going to take away with that. One last question, because I know we want to wrap it up, but we hear a lot when people are starting their own practice about what kind of things should I offer as far as the supplements, how did you go about picking, those that you trust and those that you recommend? I mean, obviously you have great experience, but for someone kind of just getting into this, what were kind of the things that you looked for? I mean, obviously, when you come to a MAPS conference, we vet all of our vendors and we have amazing ones and we have such resources for you. But for someone just getting into it, how would you recommend that they kind of navigate that?
Yeah, that's a great question. And I don't know if you know that I own a supplement company called Neuronutrients.
Do tell, do tell.
So I'm a big snob when it comes to supplements. I mean, there's a word called pharmacovigilance, and what that means is, in this bottle, in this product, is it actually what it says on the label? And is it clean? Is it contaminated? And are they using high quality ingredients? So when you're choosing originally to align with a company or a place, there's something called Doctor's Supplement Store. They're not the Full Script. So there's a place called Full Script. Most of you have probably heard about it. And I don't know if I should say this, but to me, it's becoming like the Walmart of, big, because they have so many brands.
Yeah.
Doctor Supplement Store is more of a kind of a boutique dispensary. So you can have them in your office, and
They're great. They're a great organization too.
I love Doctor
Very trustworthy, amazing people. Just someone who feel like, to your point with the Full Script, it catches on and you can't, it's a business, right? So they want to expand and expand, but I really appreciate Dr. Supplement Store and places like that know it's really important to be able to put that stamp of approval on things.
Yes, and I think they're also vetting who they're onboarding as, who they're allowing to be on there, all of their different supplement providers. And you want somebody that's doing third-party testing. You want somebody that is, especially if you're treating kids, you want somebody that delivers products that they're going to be able to take because they have palatability. You want some place that are thinking about capsule size and delivery mechanisms. So, I like different companies for different things. And you will get to that point where you're like, wow, really for a transdermal B cream, I really like Neurobiologics. And, you just learn over time. And it's a great place to find different providers, like at the, walk the floor on the conference and really see, well, who's at the floor and what are they selling? And, like you said, there's a reason that you let vendors in.
Yeah, we're very picky with that because we know we want the practitioners to feel like, okay, if they're here, at least at MAPS, if they're here, then their products work or they are a trusted organization. We really want to keep it so that when you're walking that floor, like you just said, you can trust that the people there, we obviously have not just one formulary or not just one, kind of supplement. We have many, but to your point, you might like Master Supplements probiotics, but you might like someone else doing a compound, it's kind of just pick and choose. But I feel like the opportunity at conferences like MAPS really give you a chance to kind of look and see what's out there.
Yes. And I will say this for providers starting their own practice, it's part of my consent paperwork. I call it the fine print. And I just put it out there, like, you know, their companies make money off of selling supplements to you, and you can go wherever you want to buy them. It is not an obligation in our relationship, and it can be considered conflict of interest. And I don't want any of that between me and my patients. I will tell them that I'm a snob and I know good quality. And sometimes I'm very brand specific. Like, I like a certain fulvic and humic acid, Humavir. I really like that company. So I'm gonna really encourage them to go there. It's hard when your patients are like, well, I just went to Amazon and kind of bought the cheapest things, because they might not have the right efficacy. The
And
efficacy.
they don't know that you can order from Amazon and it's not, there are some people you can trust on there, some companies, but some, it's like a wholesaler. And parents don't know that. You have to explain that to them.
Yeah, yeah, absolutely. But there's the business side of that for the provider too, and I think just transparency and having that conversation right up front is good, because it builds trust with the patient. And they know you're not just all about, getting money from them from their supplements. So that's another thing to consider.
Excellent, excellent. Well, this has been a wonderful conversation. I'm sure very helpful. We do this talk in kind of an overview at our MAPS conference at the Setting Up a Practice with yourself and Mariah Hinchy and Mary St. Onge and Nancy O'Hare. And it's nice to get a perspective from different kind of credentialed, an MD, an ND, an MP. It's just great. But I just wanted the listeners to be able to get a little more in depth from your perspective. So I really appreciate you taking the time today. I know everybody listening will appreciate it as well.